Hi, my name is Vanessa Bacon. I'm a nurse and midwife staff educator.
Hi, I'm Firdaus, and I'm a registered nurse currently working in the home care setting.
Hi, I'm Kristen. I'm a paediatrician in Broome and I'm one of your facilitators.
Hi, I'm Mina. I'm a dentist from Perth and I'm one of your facilitators. We are presenting a digital learning tool on clinical supervision and mentoring for IMED 5801 Principles of Teaching and Learning. We begin today by acknowledging the traditional custodians of the land on which we have recorded this presentation. We pay our respects to their elders past, present and emerging. Today's small group education session will cover the following learning outcomes. 1. To define the purpose of supervision and mentoring in the clinical setting within the context of adult education theory. 2. To outline the qualities, components and challenges of effective clinical supervision and mentoring. 3. To critique the strengths and limitations of supervision and mentoring discussions. And finally, to discuss strategies for delivering feedback and supporting learning. This is a short 30-minute digital learning tool on clinical supervision and mentoring. We know that you have some basic knowledge already, so this is just a brief overview using some examples for the purpose of encouraging you to think about your own clinical supervision and mentoring practice and how you could improve. We will start with a quick comical icebreaker and then define clinical supervision and mentoring and touch on the tension between them. Then we'll be looking at the qualities, components and challenges of clinical supervision, and we have 2 short video examples of supervision sessions which you will have a chance to critique yourselves. Each example is followed by a brief peer evaluation of that supervision session. We will then have a video demonstration of a mentoring session which we will ask you to reflect on, and then finally we discuss ways of supporting learners. We appreciate that this is a pre-recorded video, but there will be times when you'll be prompted to pause and reflect, and we ask you to do this in order to get the most out of the digital learning tool and achieve the learning outcomes. Take a moment to reflect on a positive or negative experience of clinical supervision. What made it memorable and how did this impact you?
Why don't we meet at a pub over wine? Great. Oh, the meeting was now? Half an hour ago. Oh, look, I can't do now. I'm busy. I'm just about to go to theatre. Just email me. Great, thanks, bye. What did you do it like that for? I wouldn't have done it that way. I think we need to have a talk. Yeah, cool. No worries. I'll just sign you off. Good work. Sorry I'm late. I've just had such a busy day and this stuff has happened to me and... Look, I've been in this clinic all day and I need you to stay back and do this ward round with me. I know it's Friday afternoon. Come on, we've got 20 patients. Let's go. What was your name again? Ah, and when did we work together? Okay. All right, so you want me to fill out these forms? Yeah, I guess I could do that.
Clinical supervision is a structured professional relationship in which a more experienced and qualified professional provides guidance, support, and oversight to a less experienced practitioner or student learner. It is common practice in health professions education. The clinical supervisor monitors and evaluates the learner's performance, ensuring adherence to professional standards and ethical guidelines, and facilitating their professional development. Clinical supervision focuses on enhancing the learner's skills, knowledge, and self-awareness, and it often involves case discussions, feedback, and reflective practice. Integrating theoretical frameworks and models within clinical supervision enhances the learner's experiences, supporting their professional growth and promoting the development of advanced clinical skills and competencies. These frameworks include experiential learning, where the clinical supervision provides opportunities for learners to actively participate in real-life clinical situations, gaining knowledge and hands-on experiences and reflecting on them. The Kolb cycle also facilitates reflective thinking, encouraging critical analysis and promoting active experimentation to improve the learner's skills and competencies, and engaging in experiential learning. Role modelling can inspire and guide learners in their professional growth and development by actively modelling professionalism, clinical expertise, therapeutic relationships, self-reflection, and ethical decision-making. Collaborative learning emphasises the collaboration between supervisors and learners, encouraging joint problem solving and shared decision making. Clinical supervision aligns with transformative learning by creating a safe and supportive environment for learners' clinical and professional growth. It encourages learners to critically reflect on their assumptions, beliefs, and values. Knoll's 7 principles of learning incorporate prior knowledge, meaningfulness, active engagement, social interaction, practice, feedback, and consolidation. And finally, the Dreyfus model of skill acquisition allows supervisors to identify the learner's current level of competence, providing targeted guidance and feedback, and facilitating their progression to higher levels of expertise. A mentor is a more senior person in a similar role to a learner who provides support and guidance with mutual trust and respect and is generally not involved with assessment or appraisal. We will take a closer look at this later. There is a lot of overlap between clinical supervision and mentoring, but it is important to note the tension that exists between the two. We should be cautious to define these roles and not try to be a mentor and supervisor simultaneously for the same learner.
Hello everyone, this is Firdaus speaking. So what are the qualities of a good supervisor? A good supervisor has good interpersonal and professional skills. They're respectful, they establish a rapport with their students, they're empathetic, and they act as good role models. A good supervisor is enthusiastic to teach and positive as well. They're very supportive and resourceful. They provide these learners with support, knowledge, and instructions. They enhance their problem-solving skills, and they help them link theory to practice. A good supervisor is knowledgeable and clinically competent. They apply the principles of clinical teaching in order to ensure that their learners have a positive learning experience. This includes providing constructive feedback as well. Most importantly, they have a good knowledge base of the content that they're learning and ensure patient safety. A good supervisor is available and approachable. They provide opportunities for patient care and ensure that their learners are involved in patient care. They're also willing to meet up with their learners in order to help them and provide further guidance and support. Watch the video in the following slide to see how I demonstrate these qualities.
Hello Sarah, how are you doing?
I'm good, thank you. And you?
I'm good. So my name is Firdaus and I'll be your clinical supervisor during your placement. How are you enjoying your placement so far?
I'm good, thank you.
So have you had a supervision meeting before?
Yes.
So as your supervisor, it is my role and responsibility to help you identify your knowledge gaps. And then together we will establish some learning goals that you would like to achieve during this placement of yours. And then I will also create some opportunities that will help you establish those learning goals. Just to reiterate, you're a third-year nursing student, is that right?
Yes, that's right.
Can you tell me a little bit about your scope of practice?
Well, as a third-year nursing student, I am expected to practice and provide nursing care with minimal supervision. When uncertain, I should perform the skill or procedure with my body nurse.
Okay, so I'm glad that you know about your scope of practice. Is there any specific learning goals that you would like to achieve in one during your placement?
Yes, definitely. I would like to learn how to insert a urinary catheter for women.
Okay, so I can definitely arrange that. But just before you grant you that opportunity to practice your urinary catheter, I would like you to engage in some pre-readings, like access any policies and procedures of the hospital with regards to inserting urinary catheter in one of their female. I would also like to give you this form over here where you just tell me all about your strengths and weaknesses and any other clinical knowledge or skills that you would like to learn during your placement. So here you go. I will inform you of our next meeting date via email And when I also arrange that opportunity for you to insert your urinary catheter, I'll also tell you about it via email. Do you have any questions for me?
No, thank you.
Well, thank you so much for coming, Sarah.
Nice meeting you.
You too.
Bye-bye.
Bye.
Hi, Fidels. I just watched your supervision meeting. I thought it was great. What about you? What did you think you did well?
Hi, Kristen. Thank you for taking the time to watch my video. I think what what I did well was that kind of like knew a little bit about my student in the sense of scope of practice, reinforcing what she can and can't do during placement. I think I also kind of like directed her towards some good resources that she could see and read prior to undertaking that learning outcome or prior to undertaking that learning activity.
Yeah, I agree. I really think that for an initial supervisor and learner meeting, I think it was really clear. You assessed what learning she's had to date and identified her learning goals for the placement and even suggested some activities that she could undertake. Is there anything that you think you could have done better in that session?
I think I probably could have taken more time just to get a more positive learning environment, to probably orient the student a little bit more to the type of placement that she's doing, just so that the student can relax a little bit more. Also probably would have been useful that she told her that just gave her those forms and want to know about the strength and weaknesses prior to actually telling her about asking specifically what she wanted to do in that placement.
Yeah, I mean, I think all of that was pretty good, but that's probably good that you've identified those things you could improve. I just wondered as well whether potentially you could kind of make it a little bit more learner driven in that asking her to reschedule the next supervision meeting and asking her to draw up a sort of plan. But I think overall it was excellent. So well done.
Thank you.
Clinical supervision requires creating a positive learning environment that is characterized by respectful communication from the staff and a culture that is committed to teaching. Clinical supervision also requires the supervisor and the learner to ensure that patient safety is observed. A clinical supervisor needs to help their learner identify the knowledge gaps that they have, and based on the knowledge gaps, establish learning goals or expected outcomes. To ensure that these learning goals or expected outcomes are met, a clinical supervisor needs to create learning opportunities that will help the learner practice the skill or procedure that they need to learn and also fill in their knowledge gaps. Most importantly, a clinical supervisor needs to provide effective and timely feedback by using one of the feedback models, and they also need to facilitate self-reflection and review of performance within their learners, as feedback and reflection are the essence of learning. Throughout the entire process, they need to ensure that they're providing support and guidance to their learners, as this will facilitate and promote a positive learning experience. They also need to ensure that they document their work and communicate the work that they have accomplished with the necessary educational body. To finalize, they need to provide an assessment of their work and an assessment to their learners to see if and observe if their learners have met their expected outcomes, and they also need to evaluate their work in order to see how they can improve.
Being an effective supervisor can be highly challenging at times. There is always going to be a need to balance the time required for supervision with the needs of the health service and the patients. Unfortunately, very few professions have dedicated protected time for supervision, but this is changing. There can also be challenges with the learners themselves. Some learners are not engaged in the supervision process, and other learners can be underperforming. Most supervisors fear or avoid having to manage learners who are having difficulty. Giving constructive feedback is a skill that needs to be practiced just like any other. Managing learners in difficulty can take up more time, and documentation is essential. And then there is the challenge of external influences, such as the recent COVID-19 pandemic. We are now going to show you a short video example of a midterm progress meeting between supervisor and learner. Thanks for arranging this catch-up today, Kira. It's really good to sort of meet, about halfway through your term just to see how everything's going, and I do want to be able to give you some feedback as well. So first of all, how are you finding paediatrics?
Yeah, really enjoying it. Love the team effort, enjoy sort of working with the kids, which I was initially really scared of, but I'm really enjoying it.
Good, yeah. And do you feel like we're meeting your kind of learning goals?
Yeah, I think I've gotten a lot out of this term so far, and I'm hopeful to continue building on my skill set over the next sort of couple of months that are remaining in this rotation. So yeah.
Good, yeah. Look, overall I agree that you're doing really well. You're highly confident, efficient, and quite knowledgeable in paediatrics. And I guess an area of, that you could improve, I have noticed on a number of occasions, sometimes I think it's because it's quite busy as well, but your communication with families can be quite rushed, and I've just wondered sometimes whether they've actually understood the sort of information. What do you think about that?
Look, I mean, I always thought communication is one of my strengths, but I certainly take your feedback on board because, as you say, it is quite a busy job. So maybe just feeling pressure to get everything done sort of affects how I'm communicating and rushing through important communications or conversations that should really be given a lot more time. So yeah, I'm very happy to take that on board, and I appreciate that feedback.
Yeah. Look, it can be tricky sometimes, and we all have good days and bad days.
Yeah.
And I guess my suggestion would be to sort of just slow down and take a bit more time, and potentially over the next couple of weeks you could join me in clinic and, or any of the other consultants to observe just some other approaches to those sort of family interactions and those kind of delivering information, and so you can pick up some more strategies. And then you can take some time to sort of reflect next time you're doing those sort of discussions yourself, and think about how that's changed.
Yeah.
So from here, if you could just look at your roster over the next couple of weeks and make a bit of a plan, and then set a catch up again for a month or 6 weeks time, and we'll just see how everything's going.
Yeah,
How does
that's
that sound?
good. That's
Great.
I really appreciate it.
Thanks,
Thank you.
Kira. Now take a moment to think about and write down what went well in that supervision session and what could be improved. Here's what Vanessa and I thought about it.
How do you think you went with that?
Yeah, look, I think that I was really good with the positivity, and I think I was able to, come up with a plan, and I was quite clear about what I expected from here. Yeah.
Look, I would definitely agree. And you also had an amazing communication style that allowed for her to self-reflect as well. So, no, I think you did really, really well. Do you think personally there's anything you can improve on next time?
I think that it would be nice to have more time to actually just explore a bit more about her learning goals and how she's going with other aspects as well. And also, I was just thinking that it would be nice to have a kind of record of the meeting. So ask Kira to actually, send me an email about what we've talked about today and what was the plan, and to plan the review. So to actually be a bit clearer on that documentation side of things.
Yeah, fantastic. And that also allows for that reflective practice for herself personally, doesn't it? So from myself, in terms of anything I thought perhaps next time you could improve on, as rapport grows, I think you'll find it easier to tease out that Kira's developing her own action plan. And that will hopefully be something that will then, I guess, validate her learning process, but also give her a little bit more buy-in. But no, overall, I think you did an excellent job, and thank you so much for doing that.
Providing feedback is a critical role of a supervisor. Feedback allows the learners to gain insight into their strengths and weaknesses and to reflect on and develop strategies for how they can improve. The supervisor assists the learner to move through Kolb's cycle of reflection and to develop competency. Effective feedback is timely, specific, balanced, clear and unambiguous, and positive and constructive. We have just demonstrated 2 ways of delivering feedback. When providing feedback on areas to improve, it is important to use specific examples and focus on behaviour and performance rather than personal criticism. Remember, our role is not to try to catch the learner in their mistakes and to determine whether they're good or bad at their job, but to help learners who are struggling to improve and to support learners who are meeting expectations to continue to develop expertise and to shine.
Mentoring processes include support and rapport building, which in turn benefit both the mentor and the mentee. Growth and development through increasing self-awareness. Also challenging thought processes and promoting that thinking outside the box. Encouraging reflective practices and learning that may occur as a result, benefiting the mentee long after the sessions have expired. Also developing networking and interprofessional personal skills.
We will now demonstrate an off-site mentor dental student mentee interview. The dental student is located in a rural location. It's imperative to note that the mentor has no affiliation with career progression or assessment. Therefore, conflict of interest is minimised.
At commencement of this agreement and placement of the mentee, a mentoring contract was developed. This contract aims to ensure that both parties are aware of the length of their contract, also the aims and objectives, and on which platform they will meet. The meetings will occur weekly via MS Teams, and all communication outside of these meetings will be via email to ensure maintaining personal boundaries. The overall aim is to ensure the student who has recently moved to said off-site rural location feels supported ongoing. Nice to see you. Thank you so much for coming to our weekly session. How are you today?
Hi, I'm just feeling really overwhelmed. I'm really feel like I'm really struggling to cope with, just being out here in Derby. It's just really remote. I feel really isolated. I think I'm really struggling with just seeing these like different patients. It's something I'm not used to, like working with the Indigenous community. I just feel really at a loss that I'm just not, doing a good job.
Okay. All right. Well, thank you for sharing that. It is important that we do communicate, and that's how valid this mentoring agreement is. And firstly, let me just say the sheer fact that you're feeling that way tells me that you're probably doing an amazing job because you do care about the well-being of your clients from their dental health perspective. And also, please do appreciate that moving to a completely remote location, it does have challenges. Could you perhaps tease out what some of the particular challenges are for yourself, and that we may be able to reach a bit of a conclusion for yourself?
Yeah, it's been really hard. They, just first thing, probably communication. I feel
Okay.
like I struggle with language barriers, and I'm not sure if I have the right way of delivering information to our patients. I also feel I struggle with the time management
Yeah.
and keep sticking to the times, and I just feel like there's a lot for me to do, and I just feel very alone in having to do it all.
All right. Well, firstly, let's reassure you that you're not alone. Can you tell me who is in the clinic with you?
There's another student who's come up with me, and also we have a supervisor who's also come up to help oversee the treatment that we're doing.
Yep. And have you spoken to your supervisor about the communication barriers and also about the overwhelming with time management?
I haven't yet because I worry that they're going to judge me and they're going to think that I'm not capable. So I've sort of just tried to take it all on board and not really, ask for any help or advice.
Okay. All right. So, Mina, the main thing I guess I'd like to share with you, I had a previous experience early on in my career, and like yourself, wanted to appear that I had it all together. But we just need to remember that fundamentally we're there for our clients, and trying to save face isn't going to benefit them or us in the long run.
Yeah.
So, what I found really helpful was, in fact, sharing with people at the site, to perhaps come up with a unanimous decision that may be able to escalate our concerns, because I'm sure your colleague, your co student, is also feeling similar. So, what do you think you might be able to say to your supervisor?
Um, I could probably address the issues of the communication, I suppose, and see if they have any tips for how I can help improve my delivery of instructions for patients. Also, with the just the timing of appointments, maybe if they could give me some advice. Yeah, it's just really tricky because I don't really know them, and I just, it's hard. It's just really hard.
Okay, so I wonder also if you ask the other student to be present for this meeting, perhaps make it an informal setting where it's more of a conversation rather than an escalation initially. So you're having that conversation just for the two of you to air any concerns. The other thing that's important in this point is to look outside the box, which I know is very difficult when you're overwhelmed. But if communication's a problem, there will be resources within Derby in order
Okay.
to ascertain the local tongue, or even perhaps body language that may be able to assist with things like that.
Yeah,
Yeah.
okay. I think that's a good idea. I'd probably feel more confident and more comfortable if, the other student was with me as well. So
Yeah.
that's
Well, I
really good.
think you yourself have identified some amazing avenues you've got there in order to be able to alleviate some of these concerns. But please be reassured that you're not alone.
Thank
Aside
you.
from our weekly meetings, I'm more than happy to be contacted via email. And I do think you've taken on a mammoth task. So please be reassured that you're doing an amazing
Thank
job.
you. Thanks.
Yeah.
Thank you.
Is there anything else I can help you with?
No, I think that is the main thing. It was just getting all on top of me and I was feeling really
Yeah.
stressed. I just wasn't sure, how to address it all. So I think if I can start with these small things, I'll be able to just feel less overwhelmed and less emotional about it
Great.
all. Yeah.
Yeah, great. Well done. So if we meet next Thursday again, we'll have a discussion about how you've gone with that conversation, but also perhaps I'll get you to tease out some more things that you may be able to identify, because I think you're there for 12 weeks, aren't you?
Yes,
Yeah,
yes.
beautiful. Great. All right. Well, thank you so much.
Thank you so much. Thanks for listening. I appreciate it.
Always here.
There are many strategies to support learning. These may include ensuring a safe learning environment whereby learners feel free from judgment. In addition, building trusting relationships with the learner will also aid in the overall process. A supervisor may develop a structured education plan early in the process in order to clearly outline objectives and learning methods that may be utilised. Any assessments, whether they be formative or summative, must also be defined early. Additionally, through understanding the principles of adult learning, supervisors may incorporate methods such as experience, validation, and also readiness to learn in order to support the learners.
We hope our digital learning tool on clinical supervision and mentoring successfully achieved its learning outcomes by providing a comprehensive overview of the benefits and importance of these practices in enhancing professional growth and development within health professions education. Overall, this session emphasised the critical role of clinical supervision in creating a supportive environment for reflective practice and improving patient care. It also highlighted the importance of mentoring relationships in providing guidance and support to mentees, facilitating knowledge transfer and fostering personal and professional growth. Now, take a moment to write down 1 or 2 learning points from today. After your next supervision or mentoring session, We'd like you to consider taking the time to reflect on some of the learning points from today and how they can improve your practice. If you are the supervisor, you may want to ask a peer to observe and evaluate one of your supervision sessions so that you can receive further feedback.